Bedside nursing report. Traditionally, shift-to-shift report takes place at the nurse's station with multiple distractions or in a conference room that takes nurses away from the patients. When these things occur, you have issues such as patient falls, medication errors, as well as decreased patient satisfaction and safety. It can be frustrating to the nurses because they're trying to get report and they're constantly being pulled in different directions. It can also be a dissatisfier for patients because they feel that they are being ignored or that they're not involved in their own care. Bedside Nursing Report is an initiative that can help solve these problems. Bedside Nursing Report was recently started on the unit that I work for, which is what drove me to pick it for my project. PICO question. Does Bedside Nursing Report completed among nurses on a medical surgical unit improve patient satisfaction and safety when compared to traditional nursing report completed at the nurses' station? So for RP, we are looking at nurses on a medical surgical unit. Though in theory, you could apply this to any unit, whether it be inpatient or outpatient. Our I is Bedside Nursing Report. Nursing report is completed on a daily basis, but some units complete the nursing report at the bedside, other units will complete it at the nurse's station. And our C is traditional report at the nurse's station. Finally, we look at O, our outcome, which is to improve patient satisfaction and safety. For completion of the literature search, the key terms bedside, nursing, and report were used. Databases were focused with CINAHL Complete as well as Academic Search Premier. When completing the search, multiple articles were found. In order to narrow the results to a more valid article for the presentation, criteria was that the article be written within the last 5 years. It was to come from a peer-reviewed academic journal. It also needed to be a primary source, so the author needed to be the one that was completing the study, as opposed to reviewing or using data from a study that had been completed previously. I also looked for articles that focused with medical surgical units and that really focused towards the PICO question. It was not very difficult to narrow the search, and it was rather easy to find articles that were valid regarding bedside nursing report. Looking at all of the articles together, they all agreed that bedside nursing report was a positive change with many benefits and minimal downsides. Each article addressed outcomes in regards to bedside nursing report a little bit differently, so it really gave you a well-rounded picture. So Sherm's article focused on the bedside nurse's perception of actually completing bedside nursing report. With Rogers, we not only looked at the nurse perception, but in addition, patient perceptions of bedside nursing report as well. They also looked at the number of patient falls during shift change and medication errors to see if bedside nursing report had a positive impact on those things. Groves focused completely on bedside nursing report improving patient safety. Lebriel also focused on just the nursing perception of bedside report. And the final article, San-Jakelin, looked at patient and nurse satisfaction. It also looked at falls during shift change medication errors, as well as the amount of nursing overtime. So with each article focusing on different aspects of bedside nursing report, it gives you a very well-rounded view of how well bedside nursing can be. It also allows you to draw multiple conclusions and contrast by comparing and contrasting the articles to form an opinion of bedside nursing report and the benefits that it can have. All of the articles were quantitative design except for Groves, which was qualitative. So they were all pretty similar in that they compared with, they had surveys involved. And some articles had a little bit different of an opinion than others. For example, Groves' article felt that while bedside nursing report was a positive thing, there needed to be more research to conclude definitively that bedside nursing report directly improves patient safety. There could be also other outcomes or other initiatives that are being done that could improve patient safety that's not related directly to bedside nursing report. But in the case of Rogers and San-Jaglin, they both provided not only data on perception of nurses and patients of bedside report, but they actually tracked numbers. And both of these articles showed that after the implementation of bedside nursing report, not only were the number of falls decreased, but also the number of medication errors. Now, in the San-Jaglin article, they had to be a little bit careful in regards to medication errors. In this article, they collected data before implementation, 3 months after implementation, and 13 months after implementation of bedside nursing report. And in the article, they discussed that there had been some other initiatives to improve the decrease in medication errors, and because of those initiatives, they were able to say that bedside nursing report did contribute to a decrease in medication errors between pre-implementation and the 3-month mark, but they weren't able to completely comment at the 13-month mark because they couldn't say if the decrease in medication errors was solely due to bedside nursing report or if the other initiative that they had started in order to reduce medication errors had played a factor in that as well. And then one thing that seemed to be a common trend, especially when getting the nurse's perception of bedside nursing report, was that it's unable to be completed in a timely manner. So you're in the room with the patient, you're discussing the patient. If the patient has questions, there is a possibility that during bedside nursing report it takes longer because of those factors. But the San-Jaglin article tracked nursing over time, and even after the implementation of bedside nursing report, they went through time cards and there was no increase noted in the amount of overtime for nurses after the implementation of bedside report. So though some nurses perceived that bedside report took a longer amount of time, at least in this article and study, the numbers didn't show that. So with all of the articles focusing on the fact that the implementation of bedside nursing is a beneficial thing, it would be recommended as a new practice recommendation. So as I said earlier, both the San-Jaglin and the Rogers article showed supporting facts that bedside nursing report decreases the number of patient falls at shift change, and as well as decreasing the number of medication errors. So it would be a beneficial practice to implement on a medical surgical nursing unit. Now, this isn't to say that there aren't barriers to implementing bedside nursing report. Some barriers are nursing staff resistance, especially in relation to the fact that some nurses perceive that bedside nursing report takes a longer amount of time than traditional report, which that leads into the second kind of challenge or barrier, is that the perception of time of completing the bedside nursing report is too long. The other challenge can be that in order for bedside report to be valid, you have to make sure that it's done consistently across the board. So inconsistencies in the completion of bedside nursing report can also be a barrier / make bedside nursing report more, or I should say less effective if things aren't being done consistently. So in conclusion, bedside nursing report has many positive benefits and outcomes. There are minimal downsides to completing nursing bedside report, and there seem to be a very small number of barriers or challenges to implementing this. So therefore, implementation of bedside nursing report would be a good practice. And listed here are the references of the 5 articles that were used for the synthesis of this presentation. Thank you for your time.